Hello. On behalf of the Mountain Plains Regional Disaster Health Response System, I'd like to welcome you to this second in our 9-part series on weapons of mass destruction. My name is Dr. Peter Pons. I'm an emergency physician in Denver, Colorado. This second module is going to deal with scene size up, personal protective equipment at one of these events. We'll talk about scene control. We'll talk about downwind hazard analysis. We'll talk about the process of victim triage and the utilization of appropriate personal protective equipment. One of the most important things is to recognize that, in fact, a WMD event has occurred. And if that is the case, approaching the scene in an appropriate and safe manner. Obviously, isolation zones need to be created, much as you would at any hazardous materials incident. We'll talk about exposure versus contamination, and we'll talk about the need to select and wear the appropriate personal protective stuff. Okay, when you are dispatched to the scene, and for that matter, if you're working in a hospital and you're getting information that is coming to you either from patients who presented ambulatory or from EMS personnel, listen carefully to the information that's being provided. Listen for clues that suggest a WMD or other hazardous materials release has occurred. And often there are clues in the information. When you're arriving at the scene, stop before you approach it, look and listen for clues. Often, responding personnel just run into the scene in order to deal with casualties that they can see. But the reality is this is the time to stop, step back, and do an assessment from a distance to see if there's anything that suggests that a WMD event has occurred. So what might those things be? Well, an explosion with little or no structural damage. That would suggest that the intent of the explosion was something other than damaging a building, that perhaps it was to release a WMD agent. If there's a report that a device of some sort is dispersing a mist or a vapor, again, strongly suggestive of a chemical or biologic agent. Are there lots of casualties, all of whom are having the same symptoms, the same signs? Got to worry, this is a chemical agent. Multiple casualties with no apparent reason for trauma, again, suggesting something other than an accidental incident. Unusual odors, liquids, spraying devices, or cylinders, again, suggesting something's been released. Dead animals. This has been a clue in the past for emerging infectious diseases and clearly could be a sign of a release of a chemical or biologic agent. And then if you respond to a scene and you find that, in fact, there's discarded PPE, well, there's a clue that somebody was wearing that and there probably was a reason for it. So, initial steps for the scene management is approach it upwind and upgrade for safety. And as you see in the photo, stop at a safe distance to collect information. This is a key step to identify whether or not a scene is safe for immediate entry. Of course, anyone coming onto the scene afterwards should be alerted about your suspicions for the release of a potential WMD agent. Once you suspect that there is an agent involved, identify the need for personal protective equipment and communicate that need to all subsequent responders. Consider secondary devices. The sad reality is that if, in fact, there was one device that was there, there's probably a second device. And number two is waiting for you. So be prepared. Somebody should be conducting a search looking for additional devices. And if you see any liquids or visible vapors, obviously contact with those things should be avoided. And then, depending on the nature of the incident, identify what additional sources you may need and request them. Do you need hazmat? Do you need the bomb squad? Obviously, police will probably be responding. Is the number of casualties large enough that it exceeds your available resources? Do you need mutual aid? And I'm going to throw in here that the additional resource that should be notified as well is the local hospital system. Potentially receiving hospitals need to be notified about the incident so they can take the appropriate steps. They should not be surprised by either the arrival of patients who were ambulatory and self-transported, or patients that were transported by EMS, but formal notification of the concerns was not relayed. Mass casualty incidents and disasters of all sorts really should have an incident command system set up. Same thing is true both at the scene and in the hospital. If your incident management system at the scene is already established, then subsequent arriving responders should report to the incident commander or the staging area as assigned. Before going in, remember, 95% of past terrorist attacks have used explosives or incendiaries, and secondary devices are a common phenomenon. So look for them, be prepared for them. And then, depending on the chemical that's released, the environment can also be explosive. And so that is a consideration as well. Biologic agents, not detectable by the senses. They have no odor, they have no taste. So you have to suspect that they have been released. And obviously, the incubation period, which for most of these is a matter of days, allows for infection and subsequent cross-contamination and cross-infection, secondary infection. Chemical agents. There's always a concern, depending on the chemical agent, that the PPE you're wearing can degrade. Particularly true with the corrosives and caustic chemicals. So that remains a concern. And then what other chemicals are present at the incident site that are secondary to the actual incident? This is particularly important when responding to an industrial site. Radiation, not detected, no odor, no taste, and the damage is irreversible. PPE offers some protection. We'll talk about this more in the radiation presentation, but have to be prepared for these incidents. And a huge factor with these is psychological effect, even if there are no immediate clinical effects. Asphyxiation, depending on the agent, is a concern. Oxygen deficient atmospheres need to be identified prior to entry. Chemical compounds that can cause pulmonary edema. We'll talk about these. And then there are chemicals, obviously, that interfere with the utilization of oxygen by cells. And the choice of respirator and filter on that respirator are key in order to appropriately filter these particular agents. So, an incident happened. There's been a release of something. We have to start creating our zones of care, our zones of exclusion. The hot zone is the zone that contains the actual contaminated area. That's the area in which whatever the agent is, it has been released. And it has to be large enough to protect people that are outside the immediate incident area. Nobody goes into the hot zone without appropriate personal protective equipment for the potential agent. The warm zone, this is the support zone for the hot zone. It is also the area in which decontamination will be performed. And once again, appropriate PPE has to be utilized in this zone as well. And then the cold zone, this is where all of the supplies, resources, and personnel are staged. It is the area where triage and transport will occur, where the command post is located. It's the area that has no contamination and no threat of contamination. This graphic is a sort of gross demonstration of what these zones would be. Here you see the contaminated area on the left with a line of demarcation and access control point. This is the hot zone right here. We then create our decontamination corridor into the warm zone where personnel will conduct that decontamination. These personnel will be wearing appropriate PPE for their role. And then once again, we have a line of demarcation for the warm zone, and nothing that is contaminated gets beyond that until it's been decontaminated. Control points are created to control access. And once you go out of the warm zone, everything, including patients, should have been decontaminated. Gas and vapor chemicals in particular spread quickly, present a significant downwind inhalation hazard. Liquid will spread out depending on gravity, and depending on the liquid, it may vaporize and then present an inhalation hazard. Solids represent a contact hazard, and so you have to be prepared to decontaminate these. Now, contamination versus exposure. Contamination means physical contact with the agent. The contaminant is generally outside the body on the skin, causing exposure. Exposure is when the contaminant has entered the body and is causing clinical physiologic effects. And obviously, our exposure can be limited using time, limiting the amount of time to which you are exposed to the contaminant, how close you are to it, and any shielding or PPE that's used. Exposure typically occurs via one of these routes or more, could be several. Inhalation, absorption through the skin, ingestion into the GI tract, or injection. There are 4 factors that determine the physiologic effects from exposure: how much of the contaminant you are exposed to and what the concentration is, how long you were exposed to it, what the route of entry was, and what the particular toxicity of that contaminant is. Now, downwind hazards. This is a huge consideration for both responders as well as protecting the general public who may be nearby. A number of factors are involved in predicting the downwind hazard, and those are listed in the left-hand column: wind, air stability, temperature, precipitation, cloud cover, etc., the terrain. Unfavorable conditions, as you might guess, are windy days, cool temperatures, because that tends to keep the chemical around longer. The terrain, now this is focused more on natural terrain, but let's include urban settings with buildings, etc. and the particular agent and method by which it was disseminated. The nerve agents, such as VX, unfavorable. It's an oily compound, it's liquid, hangs around for a long period of time, and it volatilizes slowly. On the other hand, if you look at the right-hand column and you look at the agent list, sarin volatilizes very easily and disperses relatively quickly. Unfortunately, most of the time, you don't know the agent, you don't know how pure it is, you don't know how much there is. In urban settings, buildings and the terrain have not been modeled well in advance. You probably don't know the dissemination parameters, and the agent cloud, vapor, etc., is gone. So it becomes very difficult to predict the downwind hazard. So factors to consider: the time of day, the temperature, the agent type, how it was released. Was it a point source? Was it a line source, etc.? Was it indoors or outdoors? Was there an associated fire? Obviously, smoke can further spread things. If it's indoors, is there an HVAC system which can spread it? And what planning has been done to deal with these incidents? Excuse me. Now let's talk about personal protective equipment. Why is it so important? Well, a great example is the Tokyo subway attack. The Tokyo Fire Department responded when there was the report of casualties, and 10% of the responders presented to the hospital with acute symptoms from sarin off-gassing in ambulances. At the primary receiving hospital, 1/4 of the hospital staff developed symptoms of sarin toxicity. So PPE, why is it important? Well, it's important because it protects you from this bad stuff. It's designed specifically to provide protection from all of the various routes of exposure. It's a barrier between you and that contaminated environment. And it has to protect you from both inhalation and contact exposure. Training is required. It's been mandated by here in the US by a bunch of different agencies. And if you have a risk of exposure to hazardous materials, and this obviously includes hospital personnel exposed to infectious diseases, the appropriate equipment and training is mandated to minimize your risk. So PPE, not just the bad stuff. I keep on stressing that because it's an important point. And in fact, we're much more likely to deal with the need for PPE, not due to a terrorist event, but to everyday activities such as hazmat incidents and various infectious diseases. And now we can add COVID to the list. All of your PPE supplies and equipment should be inventoried and checked to be sure they are usable, they haven't deteriorated, they're in good working order. And every responder should practice the use of PPE appropriate to their role. The Environmental Protection Agency has identified 4 levels of protective clothing ensembles, depending on the function you will fulfill in one of these events. The level of protection depends on the respiratory and skin protection. The highest level is vapor protective, and it has a supplied air system. Lower levels provide protection against splash of the agent, and it filters the air. And then obviously the lowest level is minimal or no protection. So level A protection, you are fully encapsulated. This provides the highest level of protection for skin, eyes, ears, mucous membranes. As you can see from this photograph, you are essentially in a moon suit. You are fully isolated from the outside environment. As a result, and you notice from the picture of the individual facing sideways, you will carry your self-contained breathing apparatus, your oxygen supply, in a tank on your back. This requires prior training. Learning to use an SCBA, self-contained breathing apparatus, during an event is not something that should occur. Level B protection is used when you need high levels of respiratory protection, but you're less concerned about the skin and eye protection. Excuse me. It differs from level A only in that it provides splash protection through chemical resistant clothing, and you're not fully encapsulated. And you can see here, this is a less restrictive ensemble, but again, air is, in this particular photograph, is being supplied through an SCBA. Level C protection is selected when you need even a lesser amount of protection, and typically this involves an air purifying respirator, something that will filter the air that you're breathing. So you're not using something that's supplying air to you. Level C protection can be selected when you know what the likely substance is, its concentration has been measured, it's below the level that's immediately dangerous to life and health. Obviously, the oxygen content has to be the same as atmospheric air because you're filtering the air. And the cartridge filter that is being used is specifically designed for the particular contaminant or the class of contaminants. Air purifying respirator filters, they are color coded for the various agents. And you can see that a HEPA filter is purple, organic vapors and acid gases are yellow, ammonia is green, mercury is silver. And there's now a universal WMD filter, which is typically black in color. If your air purifying respirator uses a selectable filter, you must have some idea of what the agent is so that you can choose the appropriate filter. Powered air purifying respirators are nice because they protect against particulates, gases, and vapors. You can see in the bottom left image what it looks like. There's a battery pack, a filter canister, and then in the right-hand picture, the tube that supplies air to the wearer. There are two types of powered air purifying respirators, tight-fitting ones and loose-fitting ones. The tight-fitting one, which is the upper picture, is essentially a face mask, provides better protection for respiratory exposure. If the battery was to fail or run out, it still provides you a modicum of protection until you can leave the area. The potential downside to a tight-fitting powered air purifying respirator is that it must be fit tested on an annual basis. The loose-fitting respirators are easier to use, and the nice thing about these is that for those individuals that have facial hair or have to wear eyeglasses, the loose-fitting one accommodates both of those. And you see in the picture on the right, lower right, that the individual in this does have facial hair, which would obviate the use of a tight-fitting PAPR. So, components: the facepiece or the hood, the blower unit, the battery pack, the breathing tube assembly, and the appropriate filter. And the nice thing about the blower unit is that it does sort of provide cool air over the face. And in the event you do lose the seal on your facepiece or the hood, The fact that it's blowing air into it that's filtered provides protection because it'll blow air out instead of allowing you to breathe contaminated ambient air in. And this slide is just what I said. The other thing about the powered respirator is it does improve comfort over the need to breathe air through a filter. Fit testing is required for all tight-fitting masks. It's specific to the make and model that you use. It is required to be done annually if your role is such that you would be using this. If you gain weight, if you lose weight, if you have facial or dental surgery, it requires retesting. If for some reason you choose a different type of equipment, you are required to refit test again. Now, compared to no respirator, what are the protection factors afforded by the various respirators? Well, a half face air purifying respirator increases your protection by a factor of 10. The full face respirator increases that by 50, as does the powered air purifying respirator. On the other hand, if you are wearing an SCBA or you have a supplied air device with an escape cylinder, you're talking about a protection factor on the order of 10,000 or more. So obviously, having your own supplied air is a greater protection factor. But for most things that would be done by hospital personnel, and for that matter, EMS personnel, the powered air purifying respirators provide adequate protection. And finally, the level D PPE is our standard work uniform that essentially provides no respiratory protection, some skin protection, and should only be utilized where there are no threats of any type. So here it is, graphic, level A on the left, level D next to last on the right, and you see the increasing protection as you go from right to left. Now, important point to point out is that as you increase your level of protection, the effort to work in that goes up, and we'll talk more about this. One of the questions that frequently comes up is, what about standard firefighting bunker gear? And you see an example here of a firefighter in a bunker coat on the right-hand side with a SCBA and helmet. What does that provide? Well, the military has done some testing, and they came up with something they call the 330 rule. And in fact, firefighting equipment does provide some level of WMD protection. And the 330 rule defines that. If there are live victims present indoors, firefighting equipment provides about 30 minutes of protection. If, on the other hand, all of the victims are dead, that would suggest a high level of exposure, about 3 minutes of potential protection. And frankly, if you are wearing standard bunker gear, you should exit that scene as rapidly as possible. So how do you pick PPE? Depends on what you're going to do. What's the agent? What's the degree of contact you potentially would have with it? What's the toxicity? And what's your role in managing this event? If you are responsible to enter that hot zone, to evacuate casualties, you don't know what the agent is, you don't know how concentrated it is, you should be wearing level A protection. You can use one level lower than what you use in the hot zone for decontamination operations. So in most cases, we're talking level B protection in the warm zone. And then you could downgrade that PPE requirement once you identify the agent, the concentration, and a risk analysis has been performed. Now, how about hospital personnel who might be exposed to patients who come to the hospital, have not been seen by EMS, they self-transported, and they may have been exposed to some sort of agent. Well, a study that was done now almost 26 years ago showed that level C PPE is adequate for decon activities outside the actual hot zone and for hospital purposes. So level C protection using um, appropriate dress and a PAPR would be adequate. Now, biologic protection, if there's an active release going on, an aerosol spray, then obviously a HEPA filter or a PAPR with standard precautions should be used. If the agent is T2 mycotoxin, then the level C protection. And we'll talk more about T2 mycotoxin in an upcoming presentation, but higher level of protection is required for that. On the other hand, if the patient is already ill, they're showing you signs that in fact they have an active infection, the exposure to the agent occurred days ago. And just as we would for any other infectious disease, standard universal precautions that we would use in the hospital will be adequate. Other protective equipments, usually not required, PAPRs, etc., not required, except for the rare instance where you might be dealing with a viral hemorrhagic fever, such as Ebola. So every patient with a respiratory complaint or open wounds with pus in them, etc., should be considered an infectious source. Standard precautions will suffice for most of these. And if you're dealing with the highly infectious transmissible ones, pneumonic plague, smallpox, viral hemorrhagic fevers, then the HEPA filter mask is recommended. And if you're going to generate aerosols in a procedure such as intubation, upgrade the level of protection. Radiologic protection, if you are entering the hot zone, you want obviously respiratory protection to prevent from inhaling any radiologic particles. So that means at a minimum level C, and then limiting your exposure time if there's available shielding to shield the source and protect you, obviously use it. Ideally, you would have a dosimeter to measure the degree of exposure, and then protective clothing so that, again, any particulates are deposited on the clothing and not on you. Once the area has been deconned and you have been deconned, standard precautions suffice. You'll notice in this photo, we have a tight-fitting mask with a purple filter canister. And if you read the description, filter for dust, fumes, mist, radionuclides, and radon. Again, proper selection of the filter is key. Now, wearing any of these levels of PPE, A through C, you are contained within a suit that has essentially no permeability to water vapor, which means heat accumulates within that suit. And the amount of heat accumulation depends on how much work you're doing, your level of hydration, what clothing you're wearing underneath it, what your workload is, how acclimatized you are to heat, your level of physical fitness, and the sort of terrain you're working in. Because of this, your body temperature will increase, and you will sweat. You'll sweat a lot more than usual. And in heavy workload requirements, you may sweat as much as 1.5 quarts of sweat every hour. Excuse me. Therefore, water has to be consumed to replace these lost fluids, or the responder will become dehydrated pretty quickly and then unable to function. Unfortunately, if you're in full PPE, you have no access to liquids because you are encapsulated. So the likelihood of dehydration increases, and your time in that PPE should be limited. How long can you work in PPE? Well, obviously, it depends on the ambient temperature. If you're working in cool temperatures, relatively cool temperatures, 50 to 70 degrees Fahrenheit, on average, people can work about 30 to 45 minutes, followed by 10 to 15 minutes recovery time. If the temperature increases, the duration of work decreases. So temperature of 70 to 85 degrees Fahrenheit, your work period is about 20 to 30 minutes, followed by almost an hour of rest. If the ambient temperature is even warmer, 85 to 100 degrees, people can work effectively about 15 to 20 minutes. Then you got to get them out of the PPE, rehydrated, get them adequate rest. And the rest time can be significant depending on the physical fitness of the individual, the degree of dehydration, etc. It's not easy to do stuff in PPE. On average, it takes you 1.5 times longer to perform most tasks just because of the physical constraints of the PPE. Reaction times are slower. People tend to make mistakes more often because they're in PPE. So ideally, when people are working in these high levels of PPE, two people should be working together so that each can check on the other for signs of stress and fatigue. Work rest cycles should be instituted. And frankly, this should be mandated in an effort to control heat stress and optimize the work that's being done. And those cycles will be flexible because of the variability in work intensity, the difference in individuals' tolerance to heat, their physical fitness, and the unique demands of the situation. Psychological factors in PPE. You are constrained within this restrictive clothing. It makes it tougher to hear. The mask makes it tougher to see. As you sweat and heat increases, you may accumulate moisture on the inside of the mask. Communication is difficult. You're feeling isolated. You may feel claustrophobic. And so for all of these reasons, exercising and practice in wearing these higher levels of PPE compared to what we're used to every day can help reduce these feelings so people get used to the sensation. So, work rule summary: provide relief from PPE outside the hazard area as soon as the situation allows. Implement formal work rest cycles to maintain the ability of staff to recover and then go back to work. If possible, and this is clearly not always the case, in fact, most of the time probably isn't the case, work in the shade and rotate jobs and personnel during long periods of otherwise inactivity. Provide relief from extreme temperatures. Short breaks are effective in sustaining performance. Enforce rehydration. Enforce getting people out of the PPE so that they can rest from the heat and rehydrate. And as the slide says, work smart. Proper use is critical for PPE. If you're going to use PPE, it has to be used correctly. It's not possible to be partially protected from things like nerve agents or blister agents. You're either protected or you're not. And if you're not, obviously you then become one of the casualties. So use the appropriate PPE and use it appropriately. PPE selection depends on what the agent is and what your role is. Thanks for your participation in this module and hope you'll join us for some of the others.